What to look for as a preceptor. When students come to the clinical site in the field and on the ambulance, they're going to be performing skills sometimes for the first time. Sometimes they've been there for a while and they've begun to develop themselves. As a preceptor, we want you to look for certain things and to develop some certain things in each student that's coming through. Ability to communicate clearly with patients. Students must have the ability to communicate. This is a critical aspect, as you know, as an EMS professional in the management of patients. We are not successful without clear communication, the ability to talk to patients at any time, in any situation. Students must be developing this, and this is what we're seeking for the student to grow in. Also, the ability to manage the scene and environment efficiently. Management of the scene is a tool that is learned and does take time to develop. It takes confidence to develop and understanding of how things should work. And so the student should begin developing the skill early on and progressing as they move through the process of becoming an EMS professional. The ability to complete a thorough patient assessment. Each student learns patient assessment from EMT basic on, and we want them to develop this skill in the field and be performing this skill on patients. We realize that a lot of times as a new student, this skill is kind of limited. They may be allowed to do certain aspects of the skill, but maybe not the complete skill. As they develop and as they grow, we encourage you to give the opportunity and to look for this growth in the student and their ability to assess the patient. The ability to identify a patient's chief complaint. This is the core to patient assessment, is identifying what is the patient's complaint and why are they what are they complaining of. So the student sometimes is really challenged, and I know it seems simple, but they're really challenged with understanding the patient's chief complaint. The ability to formulate and provide appropriate treatment strategies at the student's level of training. So if it's an EMT basic, an advanced student, or a paramedic student, we want the student to be able to develop these appropriate treatment strategies. The ability to follow direction and show development towards clear communication and leadership for other caregivers, the patients, and other individuals that are on the scene. Evaluating the EMT or paramedic student. Evaluation of each student is a critical tool. It's a critical aspect for the student and for the program. We need to know how the student is performing. And so I know a lot of times this is a challenge for preceptors. They don't want to hurt somebody's feelings. Maybe the investment and time and energy in the individual is not there. They've maybe struggled a little bit, and maybe in your mind you're just kind of ready for the student to move on. But evaluation is a critical step in the process of learning to become an EMT, or realizing maybe a student doesn't have the skill to be an EMT. And we need to recognize where the student is at in this journey. And the only way that we can do that effectively, outside of what we're doing in the classroom and what we're training in the classroom, is by having you help and participate in that process of evaluation. Every aspect that we've already talked about of the student has to be evaluated, and we want your feedback on those areas with the student. The student will provide you with the evaluation forms and tools to give feedback. We want you to take the time to be honest with the student. The student's been advised that sometimes they may be told some things that they don't want to hear. That's going to happen. We do encourage you to do it in a professional, mentoring way, but we still want it to be 100% honest. And so take the time to fill out that form. At the top of the evaluation form, there's a numerical evaluation, numbering them from 5 being excellent all the way down to 1, which needs improvement or poor performance. They're going to be evaluated on their skills. They're going to be evaluated on their work ethic. They're going to be evaluated on their leadership, on their communication. There's multiple areas that you will evaluate them. We want you to take the time in the areas that apply to give them a numerical score. If you score them anything less than a 3 or a 3 or less, we want you to take the time in a little box provided below that to give us some feedback why they received a 3 or a less. That's important. It's important to the program, it's important to the student to understand what it was that was their weakness or where they need to develop. Also, there's an area at the bottom for you to document what were some of the student's strengths. We want you to take the time to look at that student individually and really think about what you see in that individual that you would identify as a strength as an EMT or strength as a paramedic, and give that feedback. More importantly, on the areas that need improvement, we want you to also give that feedback. It's important. And yes, sometimes it might hurt the student's feeling. Maybe they didn't show up and look professional. Maybe they didn't look like they were engaged. Maybe they were too quiet. There's all kinds of lists of things that may present as a challenge that you can see would possibly make them not as successful as an EMT or a paramedic. Many times the students come through and they are very strong, and there's not a lot of things that they need improvement on. But we want you to look at that student critically to help them be better, because they're going to leave this clinical experience and they're going to grow and develop based upon the critique that you give them and that we give them in the classroom. And if there's no critique, there's no growth. It doesn't happen by accident. Yes, they may observe you and watch other individuals, but getting that specific feedback on areas that may be challenging for them is necessary. I find often one of the big areas is confidence, communication, and skill performance. But sometimes individuals have other challenges that may even block their true ability to be very successful. And sometimes those things can change and they can develop and improve on, but they won't improve if we don't give them the feedback. So evaluation is a critical aspect. The purpose of the evaluations are to track the student's skills. We have to track their performance of the skills. So if they're performing a skill, we need to know, was it performed correctly? That's a purpose of the evaluation. We also need this evaluation tool to be able to provide a monitoring of the student and their progress and behavior. We need to know how they're growing and developing. We want the student moving in the right direction, but without feedback, without guidance, we won't know. And we want this evaluation to be able to provide feedback for review by the student. The student needs to be able to go back and say, you know what, early on, this was an area that I was struggling in. I didn't have any confidence. But I can see through my evaluations that now that's listed as one of my strengths. I'm confident. And we can see this progression and this growth. This is also necessary for the program. It is necessary that we evaluate each and every student's performance and development. And that is our end goal, that our students come through our program, get the tools necessary to go out into the field, and they go out into the field with you, and they start to use and develop and apply these tools appropriately. But defining appropriate is through evaluation. And we need you to be an active participant in the evaluation of the student. Sometimes you may reach a point where evaluation is something you can't put on the piece of paper because you just don't feel comfortable doing that. I understand that. Simple way to fix that is to call me. I'll probably ask you to write me an email defining it so that I can have that as a document. I may ask you to fill out the evaluation form and just fax it over to me. If you're not comfortable telling the student face-to-face, I will communicate your concerns or challenges that you see in the student with the student, and I will do it appropriately. But I need that information, so please don't be hesitant to give the feedback that's necessary to identify the student's growth and performance. Thank you again.